Park.
Thank you, Madam Speaker.
My question is to the Minister for Health. I refer to the McGowan Labor government's record investment in our health system, and I ask, can the Minister update the House on the initiatives this government has implemented to attract more healthcare workers into Western Australia and outline how this is supporting our hospitals?
The Minister for Health.
Madam Speaker, and I thank the member for her question. And in fact, I got to meet the latest group of nursing and midwifery staff that have joined the East Metropolitan Health Service in the last 12 months, and I met the 1,000th nurse to be recruited in 12 months in the East Metropolitan, and it was a delight, actually, to meet that group of women. It was Iris Jamalal was the 1,000th, and it was a mix of nurses and midwives who are now working across Armidale and RPH, which is fantastic. And our public healthcare workers are incredibly dedicated and hardworking, and the great thing about our public system is they see every single person who walks through the door. Every single person who walks through the door, no matter what their income or whatever their circumstances, they all get access to a world-class health system, and that's what draws people to public health. And we're doing everything we can in a globally competitive market to make sure we're recruiting the healthcare workers that we need now and for the future. A number of initiatives launched before my tenure as Minister under the former Minister for Health, and new initiatives are helping to secure the kind of healthcare workforce that we need, including the Refresher Program and Future Graduate Workforce, which was launched in August last year. The Refresher Program and supported AHPRA registered enrolled nurses, registered nurses and midwives, and those requiring recency of practice back into the workforce. 865 nursing scholarships this calendar year have been allocated. 1,276 newly qualified midwives were all offered contracts in 2021 alone. And in order to support our primary care partners in aged care, we also engaged the Grad Connect recruitment process for aged care to support Amana, Baptist Care, Brightwater, Hall and Pryor, Juniper and Southern Cross. Our investment in mental health graduates is also picking up, with a total of 81 newly qualified nursing midwives who participated in the mental health program last year, and this year nursing midwives participated in the mental health program in 62 in this year alone. And we're also looking at new models of care, in particular for nurse practitioners. We know that nurse practitioners are highly skilled practitioners. We need more of those, particularly in regional areas, and we need to support them. And we are also looking at nurse practitioner-led emergency departments, models of cares, and nurse practitioner candidacy to support cancer services across Western Australia. We're looking at transition to practice programs focused on increasing the numbers of newly qualified registered nurses within the workforce and supporting upskilling into key specialties. Our public health transition to practice program for 190 FTE newly qualified registered nurses support the WA Health's COVID response, and there's a pathway for undergraduate nursing students to seek employment as AINs, particularly around providing vaccinations. We're upskilling to support nurses to transition into perioperative services, as well as including sponsored post-grad education and extensive skills acquisition. And we know that the Belong campaign has recruited a number of hundreds of health workers into our state over the last 12 months that's been running, including significant incentive payments. We know that this is a global and a national issue. We need a national and a coordinated response, or we will continue to be poaching staff from other jurisdictions, which is why I'm so pleased that the Commonwealth Government has established the Health Workforce Task Force, which will look at aged care as well as mental health and our broader health systems. And it is nice to finally have a partner in this space rather than a Liberal coalition government that denied anything was wrong.